Has someone you care about started showing subtle but worrying changes over the past year? Many believe that death in old age comes suddenly, but the reality is the body often gives quiet warnings, sometimes months, even a year, before life reaches its final stage. The problem is that most people overlook these signs because they seem small at first. Only later, looking back, families realize the clues were there all along, but by then, it's too late to prepare, too late to make those last memories truly count. In this video, we're going to discuss 5 key signs that often appear a year before an elderly person passes away. Some of them may be things you've noticed but dismissed as normal aging, while others may look minor but actually signal the body's slow decline. Recognizing these signs early gives you the chance to provide better care, cherish meaningful moments, and most importantly, ensure your loved one's final stage is filled with dignity, comfort, and peace. Stay with us until the end, because these 5 signs can help you prepare both emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard. You'll be able to make the most of the time left with those you love. Now let's begin. Number 1, significant weight loss. One of the earliest and most telling signs that someone may be approaching their final year of life is unintentional weight loss. At first, it might look subtle. A belt suddenly too loose, clothes fitting baggy, or an appetite fading away. Many families shrug this off as just part of aging, but the truth is, losing weight without trying is rarely good. It often shows that the body is no longer absorbing nutrients well, muscle mass is breaking down, and vital systems are slowing. Aging naturally leads to some muscle loss, but when it happens quickly, it signals something deeper. The body may be struggling to digest food or no longer processing protein properly, leading to muscle wasting. This loss of strength not only makes movement harder, but also increases the risk of falls, weakens immunity, and leaves the person open to infections. Another factor is appetite changes. Many elderly people simply don't feel hunger as before. Taste fades, food becomes less enjoyable, and meals get skipped or reduced. This isn't just preference, it's the body signaling that it's shutting down, no longer urging the brain to seek food. The result, less strength, less energy, and overall decline. Chronic conditions also play a role. Weight loss often signals diseases like cancer, heart failure, or kidney disease, sometimes long before obvious symptoms appear. Depression or cognitive decline can also reduce eating, creating a downward spiral where the body doesn't get enough fuel to keep going. Families often try to solve this by offering favorite foods or supplements. But if weight continues to drop, it's more than just diet. It's the body preparing for a deeper transition. Forcing large meals may not help. Instead, focusing on comfort, easy-to-eat foods and hydration can make a bigger difference. If you notice serious weight loss in a loved one, especially if they're weaker or less active, pay attention. It's not just appearance, it's the body sending a message. Understanding that message now helps you prepare for the road ahead with compassion and clarity. Number 2, extreme fatigue and weakness. One of the most noticeable changes in the year before death is deep, constant fatigue that doesn't go away with rest. It's not just being tired after a long day, it's exhaustion that makes even simple tasks overwhelming. Getting out of bed feels difficult. Walking across the room takes effort, and everyday activities like dressing or even talking become draining. This isn't just aging, it's the body conserving its remaining energy as organs slow down. The heart pumps less efficiently, circulation weakens, and muscles don't get as much oxygen. As a result, many seniors in their final months feel unsteady, weak, and unable to keep up with normal activities. The body's metabolism also slows. Instead of fueling movement, energy is redirected toward preservation. This is why they may sleep more, take longer naps, or struggle to stay awake. Some may even seem fine one moment and completely drained the next. What makes this hardest is the emotional toll. Seniors who once valued their independence may feel embarrassed or frustrated, withdrawing from conversations and activities. It's not that they don't care, it's that they no longer have the energy. This can lead to isolation, which speeds up decline. For families, it's painful to watch. It's easy to think they're being lazy or need to push through, but forcing activity won't help. The best thing is to understand their limits, allow rest, and make their remaining days comfortable. If you notice ongoing fatigue that rest doesn't fix, take it as a sign of major transition. This is the time to value conversations, create peace, and support them without pressure. What matters most now isn't how much they do, but that they feel loved, understood, and at ease. Number 3, increased cognitive confusion or withdrawal. As a person nears the last stage of life, one of the most noticeable changes often appears in how they think, speak, and interact. You may see someone who was once sharp and engaged suddenly forget things more often, struggle to follow conversations, or appear disoriented in familiar surroundings. They may repeat themselves, lose track of time, or forget names, even if memory issues were never a problem before. These aren't just normal slips of aging. The brain, like every other organ, depends on steady oxygen and nutrient flow. As circulation weakens and oxygen supply decreases, cognitive function begins to slow. The person may have difficulty making decisions, seem easily confused, or fail to recognize familiar people and places. Sometimes they may appear clear and alert for a short while, then suddenly slip into confusion again, almost as if their mind is flickering in and out. Another sign is emotional withdrawal. Someone close to the end of life may lose interest in social interactions. They may talk less, participate less, or sit quietly for long periods. It's not that they don't care, it's that their brain no longer processes emotions and engagement in the same way. Even simple conversations can feel draining, and noisy environments may feel overwhelming. You may also notice mood shifts. Some become more irritable or anxious, while others appear unusually calm or detached from things that once mattered. These aren't personality changes. They're the brain adjusting as the body declines. For families, this can be one of the hardest changes to witness. Watching a loved one withdraw or lose touch can feel like losing them before they're truly gone. But it's important to remember they can still feel your presence, even if words fade. Gentle reassurance, patience, and a calm environment provide more comfort than trying to pull them back into the world. If your loved one is becoming more forgetful, withdrawn, or confused, don't dismiss it. These are often early signs the body and mind are preparing for the final transition. This is the time to focus on quiet moments, safety, and peace, because even when words are gone, love can still be deeply felt. Number 4, frequent infections and slower healing. Another clear physical sign that the body is slowing down is a weakened immune system. You may notice that someone who hardly ever got sick now seems to catch every cold, flu, or infection that comes around. What once were minor illnesses now take much longer to recover from, and small cuts or bruises heal far more slowly. This happens because the body no longer defends or repairs itself as effectively. Pneumonia, urinary tract infections, skin problems, or even oral infections become more common. Families may see these as isolated issues, but when they start happening often, or when antibiotics and treatments no longer work as quickly, it's usually a signal that the body's defenses are wearing down. Poor circulation also plays a role. When blood flow weakens, oxygen and nutrients don't reach tissues as they should, slowing the healing process. Small wounds may reopen, and bed sores or pressure sores can develop, especially if the person is less mobile. These can become dangerous infections if not carefully managed. Another important point is that infections don't always show the same way in older adults. Instead of a fever, they might just seem unusually tired, eat less, or become more confused. In fact, sudden mental decline is often one of the first signs of infection in the elderly. For families, seeing repeated infections can be heartbreaking. It's natural to want aggressive treatments, more medicine, or another hospital stay. But at some point, the focus may shift from curing to comforting, keeping them hydrated, maintaining clean skin, and reducing stress on the body often provide more relief than additional medical interventions that may only cause more suffering. If your loved one is facing repeated infections or slow healing, see it as a sign the body is preparing for its final stage. The best thing you can give them now isn't endless treatments. It's care, comfort, and dignity. Number 5, major changes in breathing or circulation. One of the clearest signs that the body is nearing its final stage is noticeable changes in breathing and circulation. You may observe that your loved one begins breathing more slowly or shallowly. Sometimes they pause between breaths, or their breathing may speed up and then suddenly slow down. A common pattern called Cheney-Stokes breathing alternates between deep breaths and long pauses. Circulation also weakens. Hands, feet, or even the nose and ears may start to feel cold. This happens because blood flow is being directed to the vital organs and reduced in the extremities. Shortness of breath may appear even with little movement. Just sitting, talking, or shifting positions can leave them winded. Breathing through the mouth may become more frequent, and lying flat might feel uncomfortable. Some may even prefer to sleep upright to breathe more easily. Fluid in the lungs can cause coughing, gurgling sounds, or chest tightness. Many mistake this for a cold, but near the end of life it usually signals weakening lungs. For family members, these changes can be frightening, but in most cases, this is simply the body's natural process of slowing down. While you can't always reverse these changes, you can make them more comfortable. Keeping the room cool, using a humidifier, offering small sips of water, or in some cases providing oxygen therapy can help ease discomfort. If you notice changes in breathing, cold extremities, or bluish skin, take it as a sign the body is conserving energy. This is the time to create a calm environment, provide reassurance, and simply be present. What matters most now is not medical intervention, but comfort, dignity, and the knowledge that your loved one is not alone. Final thoughts. As we close this video, let's reflect on the 5 signs: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation. These often appear in the year leading up to an elderly person's passing. They may not all show up at once, and they may be easy to miss at first. But when you start to notice them, it's a strong signal the body is preparing for its final transition. For families, these changes can be difficult to accept. It's natural to want to push back, to encourage them to eat more, move more, or fight harder. But sometimes, the greatest act of love is listening to what the body is telling you and focusing on comfort instead of struggle. Understanding these signs isn't about fearing death. It's about being prepared, making decisions in advance, and ensuring your loved one's final months are filled with love, dignity, and peace. This is a time to cherish moments, share stories, and let them know they are valued and never alone. If you're seeing these signs in someone close to you, take a deep breath and remember, you're not alone in this journey. Many families have faced it before, and while it's never easy, knowing what to expect can give you strength, patience, and calm. Thank you for spending this time with us. Share in the comments one thing you learned today and how it helps you. Your thoughts mean a lot, and reading them encourages us to keep creating more content to inform and inspire.